My name is Kaylee and I'm doing the blood transfusion pass off. So before going into the patient's room, I'm going to make sure that the provider has prescribed this blood transfusion. I'm going to look at the blood type, which is a positive, cross-match compatibility, it is compatible. Also just going to make sure, look at all the comments and things that the physician has ordered. With some medications, it does say that I am giving a medication beforehand. I will give it 30 minutes before giving the blood transfusion. This patient had a GI bleed, so he needs some blood. We're gonna go in and talk to him about it and make sure he knows his signs and symptoms of adverse drug effects. Wait, I'm first gonna Darius and Hassan. Knock, knock, knock. Hi Darius, my name is Kaylee. I'm gonna be your nurse today. Yeah, how have you been today? Doing good? That's good. So, I've heard that you've been feeling pretty uncomfortable. Yeah? Well, because of this GI bleed, we are gonna be giving you a blood transfusion. I did check that you had signed the consent form and everything looked good there. And I'm just gonna check your name and date of birth. Perfect. Make sure you have IVs in both sites. Make sure I wash my hands and things like that. So Darius, sometimes with this blood infusion, you sometimes have adverse effects. So if you feel like you're lightheaded while giving this blood, or if you feel nausea, if you just feel abnormal, maybe have a rash, itchiness, let us know and we can stop the blood infusion. So what I'm first going to do is I'm first going to check your vital signs, make sure everything looks good there, and then I'm going to do a baseline assessment, making sure first of all that we listen to the lungs for a fluid volume overload, and if you need to, give the diuretic 30 minutes beforehand. So I'm going to listen to his lungs. Perfect. And I'm going to listen to the back of his back. Awesome. Everything looks good there. I'm also going to make sure that there's no edema in the legs. Jugular vein distension looks good. Just going to make sure on both feet. There we go. On the other hand. Perfect. Looks like you have IVs. We'll make sure that those are working. Do you have any other questions for me before I go get some things? Okay, perfect. Well, I'm gonna hurry and go grab the blood and everything. So, make sure I wash my hands. Get everything I need, some saline, tubing, flush. Okay, I'm just gonna hook you up to some saline real fast. First gonna get some gloves on. Wash my hands, get gloves on. Close the curtain for privacy. Okay, get tubing ready. Perfect. This up. There we go. Make sure that it's closed. Everything is closed. And then I'm going to prime the tubing. Oops. First gonna fill this up too. Perfect. There we go. And then making sure that the filter is completely covered right there. That looks good. I'm gonna close this. And then I'm gonna go get the blood. Everything's clamped. Perfect. Okay, so I'm gonna get the blood from the blood bank. I'll change out my gloves throughout this whole process as well. And then I'm gonna have another RN come in and check with me to make sure everything looks good. Okay, so I'm gonna have you hold this. Check the patient and his ID band. His name is Darius Hasten, right?
Darius Hasten.
Perfect. And then he has A positive blood. We're
Yep.
giving O negative, right?
Correct.
The expiration date is 3/28.
Yep.
Perfect. And then I'm gonna give you this number if you'll just repeat it with me.
Okay.
W0430
W0430
17 02
02
9897.
9897.
Perfect. Is there anything else? Just making sure that the blood looks good.
Yep, blood looks good to me. You should be set.
Okay. Now I'm going to put this in here and hang the blood up. It is clamped. Perfect. Okay, and then I have an alcohol wipe. What we're gonna do is we're gonna get into the IV site. We're gonna scrub right here for 30 seconds rapidly. And then we're gonna flush. The IV site, making sure that it's working and that we are able to put this blood in. Looks like it's working, so we should be good there. Okay, and then I'm just gonna hook this up to our patient. Okay. So now what we're gonna do is we're gonna clamp this, make sure that's clamped, and we're gonna get the blood close to the IV site. Maybe, gotta unclamp this. There we go. Get it close. So what we're gonna do is for the first little bit, we're gonna be having it go for 2 milliliters per minute. And then if we're gonna be watching for adverse drug effects or adverse signs and symptoms, making sure that they don't have the itching, rashing, nausea, just any abnormalities. After those couple minutes, we're gonna continue to open it up and make sure that everything is going good. If there was adverse drug effect, we would make sure to stop the infusion and make sure we notify the provider, and then also get rid of all this line and get new stuff and hook it to the saline. And then notify the provider, give the blood back to the blood bank. After all this is complete, you should be able to have to complete it within 4 hours, and also you need to initiate starting the blood within 30 minutes after getting it from the blood bank as well. So after all of that is done, what we're gonna do is we're gonna clamp this off, and then we will run the saline through until it is completely white. Might take a second. We would also just want to make sure we take vital signs while we're doing the 2 milliliters per minute, and then also after we're done with the infusion every 5 minutes, 15 minutes, and then an hour. So since it is completely white, we're going to shut that off. We're going to clamp this, and then we're also going to clamp the site. Oops. There we go. And then we will undo this part. Darius, if you feel like you're having any other adverse effects, like we talked about, nausea, things like that, it can happen hours after giving the blood infusion, so just let us know, notify us so we can figure out what we can do next for you, okay? Okay. After that, what I would make sure to do is, since touch, make sure I get the alcohol pad, alcohol right there, and then flush again, making sure everything's working. Perfect. Okay, and then what I would do is I would get the blood, and per facility policy, I would grab this bag, put it in the bag, and dispose of it, whatever the policy is for your facility. And then I would go and document everything, make sure that the patient's doing good, check up on him, and yeah.